What if I told you that the very tests your doctor insists are life-saving might actually be the primary reason your health is declining after age 70? It's a silent crisis in modern medicine that few are brave enough to discuss. Every day, millions of seniors walk into clinics for routine checkups, unaware that they are stepping into a cycle of over-testing that can lead to unnecessary surgery, permanent disability, or even cancer. Recent 2025 data from the Global Health Institute reveals that nearly 37% of medical procedures in patients over 70 are medically unnecessary, triggered by false positives from routine screenings. At PrimeYears Lab, we believe in evidence-based longevity, and today, we are uncovering the hidden science behind 5 specific checkups that may cause you more harm than good. One of these tests, the number 1 on our list, is now linked to 5% of all new cancer cases in the United States due to radiation exposure. That is a staggering statistic that your local clinic will likely never mention. This video isn't about avoiding the doctor, it's about becoming a smarter patient. We are diving deep into why less is often more once you cross the 70-year milestone. Before we break down these 5 dangerous tests, tell us in the comments, have you ever had a medical test that led to more problems than answers? We read every single story. Now let's pull back the curtain on the first test that might be ruining your quality of life. Number 5. The routine bone density scan, or DEXA. It sounds logical, check the bones to prevent a break. But after 70, the DEXA scan often becomes a fear generator rather than a health tool. Bone density naturally decreases with age, much like hair turns gray. When a 75-year-old woman gets a scan compared to a 30-year-old's baseline, the result is almost always alarming. This leads to the immediate prescription of heavy medications like bisphosphonates. While these drugs can help in severe cases, for many, they lead to rare but terrifying side effects like osteonecrosis of the jaw, where the jawbone literally begins to die, and brittle bone syndrome, where the bone becomes hard but glass-like, snapping under normal pressure. A 2024 study in the American Geriatric Journal followed over 1,000 seniors and found that treating mild bone loss with these drugs reduced fracture risk by less than 0.5%, yet 20% of the group suffered from severe digestive inflammation. Take the case of Martha, a vibrant 78-year-old who walked 3 miles a day. After a routine scan showed mild thinning, she was put on medication. Within 6 months, severe esophageal reflux and bone pain forced her to stop her daily walks. By focusing on a number on a screen rather than her actual physical function, her quality of life was shattered. At PrimeYears Lab, we advocate for focus on balance training, vitamin D levels, and natural resistance exercises instead of relying solely on a problematic scan result. Number 4. The routine brain MRI for senior moments. We all forget names or misplace keys, but after 70, this fear of memory loss drives many to demand a brain MRI. Here is the uncomfortable truth. If you scan any healthy 80-year-old brain, you will find white matter spots or slight shrinkage. These are often completely normal signs of an experienced brain. However, once a radiologist notes these abnormalities, it sets off a cascade of anxiety and invasive follow-ups. In 2023, research showed that 97% of brain findings in seniors were non-actionable, yet 12% of those patients were pushed into risky spinal taps or biopsies. Consider James, a retired professor who worried about occasional forgetfulness. His MRI showed age-appropriate spots, but the terminology scared him so much he fell into a deep depression, thinking he had Alzheimer's. His cognitive decline didn't come from a disease, it came from the stress of the test results. When we look at the science, unless there is a sudden personality shift or total loss of function, a paper-based cognitive screening is far safer and more accurate than a structural scan. Number 3. The cardiac stress test for asymptomatic seniors. This is perhaps the most overused gateway to unnecessary heart surgery. The stress test monitors your heart while you're on a treadmill or under chemical stimulation. In seniors over 70, the false positive rate is as high as 40%. This means the test says your heart is failing, when it's actually doing just fine. These false alarms lead directly to angiograms, an invasive procedure where tubes are threaded into your heart, and often to the placement of stents that have no proven benefit for people without active chest pain. A major study in JAMA Cardiology confirmed that more than half of stents placed after routine stress tests did not improve survival rates or quality of life. Instead, patients faced risks of kidney damage from the contrast dye and internal bleeding. Raymond, a 75-year-old gardener, had a suspicious stress test. He was rushed into a stent procedure, suffered a reaction to the dye, and spent a week in the ICU with kidney failure. He never had a heart problem to begin with. He was just dehydrated. If you don't have chest pain or severe shortness of breath, the risks of a stress test often outweigh the rewards. Number 2. Screening colonoscopies after age 75. Most international guidelines now state that routine screening should stop after 75, yet many are still pushed into the pipeline. The PrEP alone, strong laxatives, is a massive strain on a senior's kidneys and can cause dangerous dehydration. During the procedure, the risk of tearing the colon or having a cardiac reaction to the sedation is 10 times higher than any potential benefit of finding a slow-growing polyp. A 2024 review of over 1 million Medicare records showed that for every 2 lives saved by late-life colonoscopies, over 20 people suffered life-threatening complications. Take Dana, a grandmother who had no symptoms but was urged to get a checkup colonoscopy. The procedure caused a bowel perforation. She spent 2 weeks in the hospital and lost significant mobility. The irony? She had a clean scan 5 years prior. For seniors who are in good health, non-invasive stool-based tests like the FIT test are the gold standard. Zero risk, zero prep, and highly effective. Number 1. The full-body CT scan. This is the most dangerous preventive service on the market today. Often sold as part of executive health packages, these scans expose your body to radiation equivalent to 500 chest X-rays. For a 70-year-old, this dose of ionizing radiation is a massive trigger for cellular mutation. Research now suggests that 5% of all cancers in the US are radiogenic, caused by medical imaging. Full-body scans find tiny, harmless nodules in almost everyone. Once found, they cannot be ignored. This leads to biopsies of the lungs, liver, or kidneys, all of which carry high risks of infection or organ collapse. Marcus, an active 80-year-old, had a full-body scan that found a 3mm spot on his lung. The subsequent biopsy collapsed his lung, and he spent 3 months on oxygen. The spot? It was a harmless scar from a cold he had 30 years ago. The American College of Radiology is clear. Full-body CT scans for healthy people do more harm than good. The secret to longevity after 70 isn't finding more things to fix, it's protecting the health you already have. Modern medicine is a miracle when you are sick, but it can be a predator when you are healthy. Always ask your doctor, what is the specific goal of this test? And what happens if we just watch and wait? True health at PrimeYears Lab is built on movement, nutrition, and choosing your medical battles wisely. Your body is a temple, not a laboratory. What's your experience with routine testing? Let's talk in the comments. Thank you for watching. Stay informed and stay vital.